Coronaviruses are a type of virus. The one we're all talking about is new, and it causes a disease called COVID-19. Now, most people will only be mildly affected by it, but it can kill. It starts by infecting our upper respiratory tracts, which are the airways from your nose to just above your vocal cords. You may develop a fever as your immune system starts to fight the virus, and a dry cough. That's one where you don't produce any phlegm. The virus can then spread to the lungs, making it harder for people to breathe, and it can cause pneumonia. In the most serious cases, people can die from the coronavirus. This is because the immune system can go into overdrive, and that can lead to organ failure. So we need to do what we can to stop this virus from spreading. As it gets into your body by breathing it in or through your eyes and mouth, the best thing to do is wash your hands regularly and properly for at least 20 seconds. Catch your colds and sneezes in a tissue and avoid touching your face. The two main symptoms of coronavirus to look out for are a continuous dry cough and/or a fever. If you're sneezing a lot, got a runny nose or a headache, you may be ill, but you've probably not got coronavirus. So how high a fever is a coronavirus one? And what exactly is a continuous dry cough? Well, it's when you cough and there's no mucus or phlegm, basically no gooey substance in your tissue. And this is not the odd cough here and there. It has to be coughing regularly for no other reason, such as clearing your throat or smoking. So how high a fever is a coronavirus fever? Well, if you have one, you will know about it. Technically, it's a body temperature of more than 37.8 degrees Celsius, or 100 degrees Fahrenheit. But if you've not got a thermometer, basically you will feel hot, and your chest and back would be hot if someone touched you. If you have either of these symptoms, then you need to stay at home for 7 days. And if you live with other people, they need to stay at home for at least 14 days. But if your symptoms get worse or they don't go away, if you live in the UK, then you need to contact the online NHS 111 coronavirus service. If you live abroad, then call your local healthcare provider.
A lot of people are worrying about coronavirus.
We see a lot of people with masks.
And I don't want to get sick.
And I think, do I really need to go out?
For most people, if you catch coronavirus, it'll be mild.
But for some, coronavirus could be really serious.
These are mostly older people and people with underlying health conditions. Things like asthma, diabetes and heart disease. Good news is you can protect yourself, and the NHS says you should do these things. Even if you're not likely to be seriously affected by coronavirus,
You may pass it on to someone who could be. Number 1, wash your hands more. The more you wash your hands, the less likely you are to spread the virus to other people. So if you've been out in a public place, on a bus or a train, wash your hands as soon as you can afterwards. And properly wash your hands.
so that takes about 20 seconds to get them really clean, focusing on all parts of your hand, not just your palm,
Backs of hands,
around the nails, in between the fingers
wrists.
and your thumb, and use soap and water.
And when you're done, turn the tap off using a tissue and put it in the bin.
Antibacterial gels do work, but soap and water is best.
Number 2, avoid touching your eyes, nose and mouth, because that's the way the virus could get into your body. You can still touch your face, but only if you've washed your hands before. Number 3, catching your coughs and sneezes.
Experts think coronavirus is spread by droplets that come out of your nose and mouth. So when you sneeze or cough, catch them with disposable tissues, then bin it and wash your hands. Disposable tissues are better than handkerchiefs that you carry around with you all the time. If you don't have a tissue, sneeze or cough into the crook of your elbow.
That way, the germs are away from your hands, and you're less likely to pass them on unless you greet people using your elbow. Don't touch things with your hands if you don't have to. The less you touch things like surfaces, handrails, lift buttons, the less likely you are to catch the virus or indeed spread it on. Number 4, stay away from people who are ill.
If people are unwell, don't get too close to them. The closer you get, the more likely you are to catch something. Apart from that, you should go about your life as normal. That means you should go to work, go to school and see your friends, unless you've been told not to by your doctor
Or the NHS 111 coronavirus service.
And when it comes to travelling, check with the Foreign Office before you plan to go.
Now, it's important to say that there's no evidence that you can catch coronavirus from letters, parcels, or food. And these things won't work when it comes to treating coronavirus. UV light,
Antibiotics,
garlic,
and saline solution. As for masks, they're important when people are in very close contact with patients, but there's very little evidence that masks are helpful in everyday life.
If you've been coughing, or you have a high temperature, or you're short of breath, you may have the symptoms of coronavirus, but you don't necessarily have coronavirus.
But if you think you may do, don't go anywhere, especially not the hospital, pharmacy, or doctors.
Instead, phone your doctor.
Or use the online NHS 111 coronavirus service.
And they'll be the ones who can tell you what you should do next.
One of the reasons that people wear masks is they think that it's going to protect them from virus. But the virus isn't floating around in the air, so it's not protecting me against anything because it's not there. It's probably going to be on my hand because I've shaken hands with someone who's got the virus, and I have transmitted it. I have carried the virus to my face. If you're in an environment where everybody else is wearing a face mask and you're not, then it may make you feel vulnerable because you feel like you don't have the protection everyone else does. But logically, if you're not close to people, they're not coughing and sneezing on you, then a face mask isn't necessary. The virus enters the body through mucous membranes. We mean the eyes, the nose, the mouth, and it transmits from person to person, generally by us touching our eyes, nose or mouth, or if we're inhaling droplets directly from someone who is sneezing or coughing. The best way for the general public to protect itself against coronavirus and other respiratory viruses is really careful hand hygiene. So that's really washing your hands with either soap and water or alcohol gel if soap and water is not available, especially when you think that you've been exposed. So if you've been out in public places and touching kind of surfaces that other people might have touched, that really is the best way. And bringing attention to, am I touching my face? One of the problems, if lots of people who don't need face masks are using face masks or stockpiling them, it means that there aren't enough face masks available where they're really needed for people like healthcare workers who are on the front line and dealing with suspect or confirmed coronavirus cases. The vast majority of people are not susceptible to getting a severe infection. For most people, it will be a mild illness, like having a cold or a cough or the flu. It's the older people with comorbidities who are at risk, so you don't need to go and panic buy face masks.
Don't touch your face.
Contagious.
And I haven't touched my face in weeks.
Because we can't help it. It's part of our DNA. We're hardwired to do it. We know this because humans as young as fetuses in utero touch their faces. So every time you tell yourself, stop touching your face, don't touch your face, if I touch my face, I'm going to get really ill, you're telling yourself to do something that is entirely unnatural to you. When we touch our faces, what we're really doing is calming ourselves down. When we touch certain areas of our faces, what we're really doing is we're activating certain pressure points, which then activates something called the parasympathetic nervous system, which is the thing that makes us calm ourselves down internally. We see the same response in dogs and cats. Children often model the same behavior as their parents. So if our parents, when they're shocked, they touch their faces, or when they're surprised, they touch their faces, or if they're upset, they touch their faces, we're much more likely to do exactly the same thing. The irony is, at a time when it's more important than ever to not touch your face, unconsciously, your mind is constantly moving to a place where it can better protect you. By doing the things that it knows will soothe you, and so your unconscious mind will prompt your hands to go straight to your face. Whilst it's almost impossible to totally stop touching your face, a key way that you can go about making it easier would be to take out the habits which lead you to do it. So that might mean wearing glasses instead of contact lenses. It might mean wearing less makeup so you don't have to top it up throughout the day. It might also mean creating habits around how you use your hands. So rather than perhaps when you're always moving around and having your hands like this and making it so easy for them to land on your face, making an effort to cross your hands and put them on your lap. Then when the urge comes to pick your hands up and touch your face, you'll be more aware of what you're doing and you'll be quicker to catch yourself. I cleaned my hands before I touched my face.
While washing your hands is vital, if you're worried about germs on your phone, you can clean it effectively with simple soap and water. Hi, I'm Dr. Lena Sirik. I'm a microbiologist at University College London, and I'm going to show you how to clean your phone. Unplug your phone, turn it off, and remove the case. All the major phone makers warn against using chemicals, hand gels, and abrasive wipes on your device, as this can damage the screen's protective coating. Dampen a microfiber cloth with water and simple household soap. Gently rub the surfaces of the phone with the damp cloth. Take care not to get moisture in any of the openings, because even water-resistant phones lose their protection over time. Finally, dry your phone with a clean microfiber cloth. Even just using soap and water can effectively remove bacteria and viruses from your phone, and we can test that by using this little device and these swabs. The device gives a reading of relative light units, or RLUs, and that's a measure of the microbial activity on your phone. So the higher the number, the more germs are present. We tested all of these phones and their cases before and after cleaning with soapy water, and they were all significantly cleaner afterwards. On a surgical surface, we'd want to get a figure of 50 or less, and all of our phones and cases had readings lower than that. If you have an iPhone, Apple says you can safely clean it with 70% isopropyl alcohol wipes. These are the ones that you can get from computer shops or online. There are also devices that you can use to sterilize your phone using ultraviolet UVC radiation. These shouldn't harm your device, but some phones or cases could be discolored over time. Just remember, with all of these methods, as soon as you touch your phone, you're going to get germs back onto it. So make sure that you keep washing your hands regularly and thoroughly.
If you're told to self-isolate, that means staying at home, not going to work, school or other public places. You shouldn't have any visitors. If you develop symptoms, a fever or cough, then seek advice first by phone. Don't just turn up at a medical centre or hospital. If you live with others, then you need to stay in a well-ventilated bedroom with the door shut. If you have to share a bathroom, then use it after everyone else. Don't share towels and toiletries. Your waste should be double bagged. If you test positive, it'll be separately disposed of. If you live on your own, you can order shopping online or get friends to help, but they should leave it on the doorstep. The coronavirus causes a mild illness for 4 out of 5 people. Self-isolating will help protect older people and those with underlying health problems from getting infected.